When you are transgender and working with professionals of any kind, it's very unfortunate, but you experience a great deal of gatekeeping. As I said in a different video, you can see a mental health professional and say you are depressed, and they will believe you. You can see a mental health professional and say you have anxiety, and they will believe you. But for some, when you say that you are transgender, suddenly you have to prove it. You are met with skepticism, and this is called gatekeeping. I want you to understand why professionals would do this to you in the realm of being transgender. When it comes to education and training in the mental health field, I want you to guess how many courses are offered on gender and sexuality for a master's in counseling, social work, or psychology. Guess. And know that the question is how many are offered, not how many are required. The answer may shock you. In most cases, there is not a single course offered, not one. So when you go to work with someone, you are likely dealing with someone with limited knowledge and experience, unless that person seeks out additional education and training on gender and sexuality. And that also means that you probably know more than them, because after all, you're on YouTube watching videos and doing research. That also means that you are likely going to be educating them, and they are not going to be coaching you. This is a problem, because you are the one who are paying for services. When you work with me, I am not treating you with therapeutic techniques. I may have my master's degree to work in mental health, but I do not use that to work with you. I lean on my master's in education and my PhD in human sexuality education, which is nearly finished. One thing that a therapist will do is allow you to sit in silence and allow you to be in that silence. And that can be helpful sometimes, but not when you don't know what to do to go forward or when you don't even know what to say. This is where working with me is very different. I will be educating and coaching you with every step. And that is what I do with you, is educate and I coach. Think about all of the videos that you have watched. I am teaching you, I am coaching you. I can do this because of my background in human sexuality. That is 4 years of courses, plus access to a bank of knowledge, a bank of studies and research that are not even available at typical universities for a mental health degree. So believe it or not, I do not work as a therapist doing therapy when I help you. That is not to say that some therapists can't be helpful. That is just to say that when you look for a therapist, you must make sure they have experience. Working with me does have therapeutic effects because you find yourself feeling better. You find yourself making informed decisions instead of making decisions after obsessing or thinking yourself into circles. If my videos are this helpful, imagine what it would be like to meet with me for an appointment. Whoever you work with on your gender situation, if it is not me, please make sure you are spending your time getting help and not spending your time teaching them, because you are the one who is paying for the service. If you are teaching them, then they should be paying you. So please do your homework and find someone who is knowledgeable, because working on your gender situation is not a minor matter. It is significant, it is important, and so a knowledgeable professional is essential. One last thing. There are well-meaning people out there who you can work with, and if you are already their client and they are helping you, keep them. Keep that relationship going. Just add in someone who specializes in gender and then address those matters just with that person, because additional support never hurts. If, on the other hand, you have a well-meaning person who is not helpful, it may be hard to walk away. But you are not obligated to be the client that they learn and make mistakes on. Questioning your gender and transitioning is a big deal, and I wouldn't want to be anyone's practice patient. So, again, if you have someone who is helpful, who helps you on matters outside of your gender, keep them. There's nothing wrong with having more than one person, and nothing wrong with having additional support. Just make sure whoever you work with on your gender is informed and helpful.